So as Dr. Ali said, this will be just an overview of insecticide resistance monitoring in the Eastern Mediterranean region. So I'll start first with this slide, which you have already seen, the core vector control interventions, which are two. Primary one is insecticide-treated nets. It's one class of insecticide, the pyrethroid, the safe insecticide, which is impregnated in these nets to sleep under. And we have the indoor residual spraying, which is insecticides, pre-qualified residual insecticides sprayed on the walls inside the houses. The World Malaria Report 2020 reported that a total of 13.5 million long-lasting insecticidal nets were distributed, and the number of people protected by RS in our region was 7.9 million. This slide just shows the global response to the potential threat of emergence of insecticide resistance. So WHO developed this document, this guidance document in May 2012. And the framework here you see is the framework of the GPERM, and it highlights, there's 5 pillars, and the important pillar which is related to vector resistance of insecticide resistance monitoring is pillar number 2, which is ensuring proper, timely, entomological and resistant monitoring and effective data management. Again, I'm going to show you the framework for the global vector control response, which is the strategy that strengthens vector control worldwide, and this was developed in 2017 by WHO. This is strategic guidance for sustainable vector surveillance and control. And our region, again, you've seen this, has developed a regional plan of action to implement this global vector control response. I just want to highlight that in the pillars of action, pillar number 3, which states enhancing vector surveillance and monitoring and evaluation of interventions. And this is, of course, related to monitoring the insecticide resistance. The capacity building activities that have been conducted towards strengthening vector control in our region and insecticide resistant monitoring include strengthening the resistant management. This was a regional workshop in 2009, and this was aimed in supporting the countries, our member states, the high priority countries, to develop their national insecticide resistant monitoring and management plans. And also there has been support from our WHO Collaborating Center and our co-organizers of this workshop, the National Environmental Agency in Singapore, who have been conducting dengue workshops annually. And our participants from our region have gone there to get this training, and specifically in 2019, focusing on insecticide resistant monitoring in Aedes aegypti. Also recently, last year, the regional virtual meeting on updating the insecticide resistant monitoring for the Hanimat and Payamat. This was also a virtual meeting to support strengthening the capacity for insecticide resistant monitoring. This slide shows the status of the national plans for monitoring and management of insecticide resistance. So we see here there's countries that have, most of the countries have developed insecticide resistant monitoring and management plans. However, they need updating, and also there are countries that need to develop. And the document on the left, the WHO document, which is a framework for a national plan for monitoring and management of insecticide resistance in malaria vectors. This supports the countries, guides them on how to develop these plans. And these plans are important in order to conduct timely insecticide resistant monitoring and support the countries get access to funding. I just wanted to show you this website here where you can download the order form to get the supply of quality assured insecticide resistant test kits for the insecticide resistant monitoring from our WHO Collaborating Center, the University of Malaysia in Malaysia. And So you go to this website, you download the document, you complete the document, and then it's submitted, the country submitted to the WHO country offices in the country in order to get the supply for the WHO test kit bioassays. Again, this is a screenshot of the website for the downloading the test procedures for insecticide resistant monitoring in malaria vector mosquitoes. And so you download this document, and you've seen, most likely you've seen this document and you're using it for conducting this accessibility tests. So currently there's a revision of this document to improve it and to make it more practical, and also to include the new discriminating concentrations for the other insecticides. This is from the test procedures. It's the overview of the process and outcomes of the insecticide resistant monitoring in malaria vector mosquitoes. So it includes the phenotypic resistant frequency. I won't go a lot into detail in this because our colleague, Dr. Audrey Lenhart, will also explain this, and Dr. Professor Lee will also explain this in the upcoming lectures. And there's also to determine the resistant intensity, which uses the intensity concentrations 5 times and 10 times. And then there's also to determine the resistant mechanisms. There's a synergist insecticide bioassays, and there's the molecular or biochemical assays. So for reporting the insecticide resistant monitoring data, there's 2 platforms. There's the DHIS2, the Global Data Reporting System, WHO Integrated Data Platform, and there's a malaria threats map. In addition, any published data in our region. This is a screenshot from a map of our region reporting the pyrethroid resistance in the country. So we have pyrethroid here, which shows that pyrethroid resistance is common and widespread in major malaria vectors. So the red dots show the confirmed resistance, the yellow is the possible, and the green which are susceptible. And this again will also be explained in more detail in the upcoming sessions during February. So this slide just shows a figure or page from the World Malaria Report 2020, just to show the spread of the insecticide resistance in our region. So if you look at the bar chart here, you see that this represents the status of insecticide resistance per insecticide class during 2010 to 2019, and the use of each class for the malaria vector control. So if we look at the pyrethroids bar, so there's a number of countries is on the left. We see that the number of countries that distributed long-lasting nets, which is impregnated with pyrethroid, is 5 countries. And then the number of countries that implemented IRS using pyrethroid is 4 countries. And we see that there is confirmed pyrethroid resistance. So this is across countries, across the region, reported from at least one site in one vector. So the vector resistant to pyrethroids, organic chlorines, and organophosphates was confirmed in 76, wait a minute. Oops, sorry about that. Okay, 76%, 66%, and 46% of the sites tested respectively in all countries except for Saudi Arabia. Also, 25% of sites in the region confirmed resistance to carbamide in all countries except for Saudi Arabia and Somalia. So this is the data reported in the World Malaria Report 2020. So the current status of insecticide resistant monitoring in EMR in our region. So the national insecticide resistant monitoring and management plans are not complete or need to be updated for the majority of the countries. Pyrethroid resistance is common and widespread in major malaria vectors. So there needs to be more synergist insecticide bioassays in order to decide or make decision for the deployment of the pyrethroid PPO nets. Resistance to the 3 other insecticide classes commonly used in IRS is also confirmed in primary malaria vectors. countries commonly report resistance to multiple classes. There's limited data on resistance intensity and resistance mechanism through intensity, concentration bioassays, synergist insecticide bioassays, biochemical and molecular testing. So this is limiting in our region that not many are conducting these assays or molecular or biochemical or molecular testing. And this, the available data in our region will be presented by Dr. Ali. Insecticide resistant monitoring data for other disease vectors, such as the vectors of dengue, is limited or lacking, usually not monitored. So the available data of Aedes aegypti that have been reported show that there is pyrethroid resistance in these dengue vectors. The key challenges, there's limited insecticide resistant monitoring, which is inconsistent monitoring from the same sentinel sites. This makes it difficult for us to use the data effectively to show which evidence that would provide us to implement vector control, effective vector control. Timely monitoring is also a key challenge, usually miss the planned monitoring date. This might be due to supply of test kits, the delay, especially during COVID, during 2020. There was a delay due to COVID-19. Security situation where they cannot access the sentinel sites in these areas. Funding, that could be a funding also, key challenge, and limited capacity for monitoring insecticide resistance, managing data and reporting the results. Thank you, Doctor, and this is over to you now.